As part of providing care, we may have to assist a client with their eating and drinking. So it's important to check the care plan for the client's specific nutritional habits and the type of diet they may follow. We all need food and water for life and health, and it is important for our social and emotional health as well. To be healthy, we need to have a balanced diet which consists of all essential nutrients. I want to point out that in the blue binder in a client's home, you will find nutritional information and a copy of the Canada Food Guide. Please share this information with your clients. Nutrition and eating habits can be affected by many factors, and they would include personal choice. What are the likes and dislikes for food of your client? Culture and religion. Certain foods may be against your client's belief. Allergies. Do they have any allergies? And remember, allergies can develop to food at any time. And if it's consumed, it can even be life threatening to your clients. And you want to look at food intolerance. Do the client have any intolerances to certain types of food, such as gluten, lactose, as well as others that can make us sick if they are consumed? As your client ages, there are many factors that can contribute to less intake of nutrition, such as poor mouth health, dementia, vision and hearing loss, and their overall strength. With illness and their appetite, the client may not always have the same desire to eat food. Medications, anxiety, depression, and pain can change the desire to eat. With their finances, seniors and disabled clients are sometimes on a fixed income and they cannot afford the foods that provide a well balanced diet. When your client cannot afford those fresh foods, consider frozen options, which are often a cheaper way to purchase but carry the same nutritional value. If you see a nutritional change in your client, it is important to document this change and discuss it with your coordinator if it becomes an ongoing problem. When you are planning and preparing meals for your clients, there are a few things that you need to consider. Does your client have any dietary requirements that you need to follow? For example, they may have a food allergy, they could be lactose intolerant, or they could be gluten. You need to ensure that you follow the care plan for this information. With food preferences, always keep A client may have a special diet that would be prescribed by a physician. Usually, a dietitian or a nurse will ensure that this is part of a client's care plan and they will ensure proper guidance is in place. As the home support worker, it is important for you to follow the care plan. If, for any reason, your client chooses not to follow this diet, you will need to document in the progress notes and discuss with your coordinator at Total Care. Some special diets that your client may follow, but are not limited to, are a diabetic diet, a cardiac diet, renal, or a gluten-free diet. A normal diet, of course, would mean no restrictions. It is important to try and make mealtime for your client as enjoyable as possible and as easy as you can. Some of the ways to assist would be to help the client choose foods that are enjoyable and in their care plan. You want to make the meal attractive to your client, and do not give them more than you think they will want. This can make the client's task of eating overwhelming. Serve it while it is still hot, and this can be a time when you can have an opportunity to enjoy each other's company. Include the client in all of the meal preparation if you can make them feel they still have independence and choice. Even when they may not be able to understand, they may feel the sense of inclusion and be more willing to eat. Your client may have difficulty with eating. This can be due to several factors. Chewing difficulties can be due to sore, cracked, or no teeth, or poor fitting dentures. You can offer plenty of fluid, smaller mouthfuls, and ensure that they have time to chew food. The client may need to puree their food. Check their care plan and, if concerned, speak with your coordinator. Swallowing difficulties. They may present with frequent clearing of their throat, pocketing their food in their mouth, gurgling sound in their voice, or a reluctance to swallow and a wet cough. Those are warning signs and should not be ignored. They may need an assessment by speech pathologists to determine the proper consistency. A client who has difficulty with swallowing fluids may need to have their fluids thickened, and this will also need to be determined with a proper assessment. They may need to have their fluids as nectar thick, which is easy pourable, honey thick, which is the consistency of honey, or pudding thick, which holds its shape. You are required to follow any special diets as per the client care plan. Talk to your coordinator if you have any issues or concerns. A client may no longer be able to eat or drink food and need to be fed through a tube. If your client requires tube feeds, the agency registered nurse will delegate and ensure you are comfortable with the procedure requirements. You will also do a food safety course as part of your training that can be found on the employee portal.